Late-stage trials of one potential coronavirus vaccine are resuming in at least 2 countries after they were put on hold when a participant developed symptoms of a rare neurological disorder. The Oxford AstraZeneca vaccine is one of the leading candidates in clinical tests. Dr. Ashish Jha is Dean of Brown University School of Public Health. He joins us from Providence, Rhode Island to discuss. Good to see you, Dr. Jha, and congratulations. It seems like you have a new position. 2 weeks ago, you were at Harvard. Now you're at Brown. We know you're in high demand. We're glad you're here with us this morning. Really good to see you.
Good morning.
Good morning to you.
Thank you for having me on.
So it was put on hold it's resuming overseas. It's still on hold here. Do you read anything to that about why hasn't it resumed here in this country?
Yeah, so thank you again for having me on. You know, this is confusing, and one of the things that's not been clear is exactly what happened that caused the pause and why things have resumed. And I think it's really important for AstraZeneca and the researchers to be very transparent with the people of the United States, of Great Britain, of everybody, about exactly what happened so we can all have more confidence in the process.
Because we all are very nervous. Everybody wants a vaccine, but we want it to be safe, and it seems to be such a political hot potato. Why do you think it's so important that they are transparent and let us know all the details? And why wouldn't they let us know the details?
Yeah, so first of all, absolutely, we're all anxious for a vaccine. I'm anxious for a vaccine. We all want one, but we need for it to be safe and effective. You know, in general, under normal times, all this stuff is not always disclosed. It is eventually disclosed to the FDA, but these are not normal times. And therefore, given how much attention we're all paying, I think it's critical for the investigators to make all of this stuff completely public.
Dr. Jha, the CEO of Pfizer, who was on Face the Nation yesterday, said there's more than a 60% chance the company will know by the end of October whether its vaccine works. What do you make of that, and what could that mean?
Yeah, so I've been really optimistic about a timeline that we will have vaccines that are found to be safe and effective this fall. But we don't know what is motivating him to say that. I think, again, one of the things that I have called for and others have called for is that these vaccine manufacturers should absolutely make their protocols and their research and their statistical plans all public so we can understand what's motivating him to say that, what's underlying that assessment. And without that, it's very difficult to know.
Dr. Jha, if that does happen, though, if we get a successful vaccine by the fall, how long would it be before people actually get vaccinated?
Yeah, so if you think about it, we're going to have to make hundreds of millions of doses. Now, some of those are already being made, but even after we have got them made, it's going to take many months to distribute them. You know, I always say vaccines don't save lives, vaccinations do, and it will take us well into 2021 before a majority of Americans get a vaccine.
You know, the president said we have rounded a corner on this coronavirus. That's one school of thought. Dr. Anthony Fauci says, listen, we may not be back to normal to the end of next year. Where do you stand? What are your thoughts?
Yeah, so I unfortunately agree with Dr. Fauci on this. We have not rounded a corner. I think we're going to have some very hard months ahead. I do believe 2021 will be better, and by spring to summer of 21, I think life will be meaningfully better in many parts of the country. But we still have many months to go, and I'm worried that if we, sort of take our eye off the prize, we can end up seeing a lot of infections.
And what do you need to see to let people know that it's okay to take the vaccine? What do you want to see?
Yeah, I want to see data, and I want to see data on both effectiveness, and I want to see large enough number of people in the trials and a diverse enough number of people before I know that it's safe for me, my family, my elderly parents, and what I would recommend to others. So we really have to see the evidence and data before we make a decision about whether it's safe and effective.
All right, Dr. Jha, thank you. We'll be in touch. Really good to have you here today.